What type of procedure can fix my eyes, and which type of doctor can perform this procedure? As you can see, my left eye is uneven and tends to be closer to the corner of my eyes. It is embarrassing for me to take photos with friends or even selfies. I really want to get this fixed immediately, but what type of procedure will need to be done? And what type of doctor can perform this? Please help. Thank you.
Thank you for your question. You submitted a photo and you're asking a question about your left eye and how it appears compared to your right eye. And you want to learn more about the option and a recommendation as to what kind of doctor is best suited for treating your situation. Well, to give you a little bit about my background, I'm a board-certified cosmetic surgeon. I'm a fellowship-trained cosmetic oculofacial plastic surgeon. That means my background training included ophthalmology or eye surgery, followed by specialized training in the eyelids through the American Society of Ophthalmic, Plastic, and Reconstructive Surgery, and I've been practicing in Manhattan and Long Island for over 20 years. So if I could break this down for you, it might be helpful. Number one, let's label what is the issue with the left eye. The left eye appears to be lower than the right eye. And the term that we use for this condition is called ptosis, or drooping of the eyelid. Now, with the understanding that this is not something that is recent and is something that you've always had, or it's something, if it is something that's more recent, then of course you need to see an ophthalmologist to get a workup to see what the cause of the ptosis is. When we differentiate in our specialty between acquired and congenital ptosis. Acquired means something that you've acquired later in your life, and congenital meaning you were born with it. So you could probably look at your photos from the past and see if it was always like this. If your eyes were always like this, then then a further workup is not necessary. But the question is what to do. If you have reasonable muscle function, then what we do is something called a ptosis operation, where the muscle that lifts the eyelid, called the levator muscle, the levator muscle, like the word elevator, it elevates the eyelid, is operated upon. There's also a muscle called Mueller's muscle, which is located behind this levator muscle, and also could be operated upon. Now, all of these decisions are based on a physical examination and evaluating the height of the eyelid and the muscle function, as well as other things that are relevant to the actual surgery. Ptosis surgery is in general performed by oculoplastic surgeons, the doctors like myself who originally trained in eye surgery and specialized in eyelid surgery. Now, in addition, in your situation, of course, you have Asian eyes. And I think it's important that you seek a doctor who also has a lot of experience with Asian eyelids. Because of the anatomy of Asian eyelids, there are a lot of other considerations necessary when performing this surgery, depending on the approach and the type of surgery, whether it's from the front of the eyelid or from behind the eyelid. When we perform ptosis surgery with people who are adults or let's say over 14, 15 years old, we usually have the patient's cooperation during surgery so we can set the height and contour and be able to see how the eyes look so that we can maximize the symmetry. Ptosis surgery can be very tricky. It is, the muscle is very delicate, and we want to get the ideal height and shape. 95% of the time, we all say that we get a great result as we see in surgery, and 5% of the time we need to do some type of enhancement. Regardless of that, that's part of the nature of ptosis surgery. So I recommend you meet with qualified, experienced oculoplastic or oculofacial plastic surgeons, learn about their experience with Asian eyelid surgery, and find the person that you're comfortable with, and then move forward with the procedure. So I hope that was helpful. I wish you the best of luck. Thank you for your question.